Hello viewers, you're most welcome to our YouTube channel, the Fertility Hub. And thank you so much for being part of us. Thank you for subscribing. If you have not yet subscribed, please subscribe. Today we are discussing the emotions that are related to infertility. So before we proceed with our topic, I'm going to request my girls who I host with to introduce themselves, and then we proceed.
Welcome to the show. I'm Kemigisha Morin.
Welcome to the show. I'm Akantarana Prudence.
You're most welcome. And today we have a guest who is going to discuss with us about our emotions. And she's a clinical psychologist. She is a Mrs. She's Mrs. Bakarikwina Josephine. You're most welcome.
Thank you, Prosi.
I want her to talk about herself more before we proceed.
Thank you very much, Prosi. My name is Josephine Nangonzi Bakarikwina, and I'm a clinical psychologist. I'm happy to be here. Thank you for hosting me.
Yes, thank you for coming, for agreeing to come and be part of us. Yeah. Today, like I'd said, we are talking about emotions.
Yeah.
How to deal with emotions related with infertility.
Yes.
If we say emotions, what do we understand? Have you interacted with someone who has gone through emotions? What is emotions? Before we dive into that professional bit of it.
When it comes to emotions, I think it's how someone feels, and emotions vary. How I feel about something may not be how someone else feels about them. And one thing I know about emotions is that they could be positive and negative. So how you feel about any kind of situation or news or whatever, that's how I would perceive emotions. Yes.
I think it won't be any different. Like emotions, yeah, the way someone feels about something, how you react, or there are some who don't even react. So emotions is what you feel. You can let it out or not let it out.
Yeah. Okay. So emotions are the feelings.
Yes.
Okay. So our today's guest.
Yes.
Can you please tell us like some of the common emotions that are experienced by individuals that are faced with infertility?
Thank you very much, Prosi. If you don't mind, before we dive into the emotional part, I would want to give our viewers a precise overview of where is the word emotion coming from. I would want to begin with a word that we are going to define, which is mental health. Yeah. Today, we are recognizing that everyone talks about mental health.
Yes.
In very many forms. But to our viewers, I'm just going to use three words to describe mental health. It's how we feel, how we think, and how we are going to behave.
Yeah.
So basically that is mental health. How we feel is going to affect how we think and how we are going to behave. So here that bit of a triangle. Feelings, thinking, emotions.
Yeah.
And to give you a brief analogy in regards to mental health, everything that we do begins with the mind. Thank you.
Mind.
Yeah. Begins with the mind.
Yeah.
Whatever decision you're going to do, how you're going to plan for your day, before you even wake up from bed, your mind starts to think about different things.
Yes.
So how you're going to think about different things, it's going to influence how you're going to feel about that day.
Yes.
Then, as you're still processing these emotions, the way you're going to behave is going to change. Yeah. So my colleague here has mentioned that there are negative emotions and positive emotions. How we think about things is going to influence in a negative form or a positive form. Yeah. So, and there's a combination, or there's a small line between emotions and feelings. Yeah. So let's come back to emotions. As we dive into this discussion of emotions, we are going to understand, we are not going to focus only on infertility, but we are going to focus on the different aspects of life. Yeah. How do they influence our mental health, and how are they going to influence our emotions? So take an example. I would like to use a couple of examples. Take an example of, let me say, monthly periods.
Yes.
Yeah. Women are expected to experience monthly periods.
Yes.
But are there moments where they delay or they come very fast?
Yes.
Now, there's a reason as to why. Sometimes you're not aware you're going through some couple of things or some couple of situations that are influencing your emotions. So inside your body, there are a variety of hormones playing around that are influencing your body physique to react. And sometimes, have you, I want to bring another example so that the viewer is able to understand.
Yes.
Yeah. And another example would be the analogy I can use in form of an example is you see the piano?
Yes.
Yeah. Now, for a piano to play beautiful melodies, to bring out those rhythms, you have to practice,
Yes.
practice and practice. But then apart from practicing, you need to carry out maintenance on it. So
Yes.
imagine your brain is like that. Yeah.
Yes.
You have a couple of things you need to focus on, but then how is your mental well-being?
It's the maintenance.
Yes.
Okay.
Now, when we look at fertility, you're looking forward to something positive coming out of it.
Yes.
But then the processes and procedures you're going through tend to influence our emotions. Yeah. So when we look at a couple of emotions, for example, sadness. Now, we do not stop people from feeling sad.
Yeah.
We want them to acknowledge these feelings and emotions. But where we draw the line is when the sadness becomes extreme
Yeah.
and very constant.
Yeah.
Yeah. Then we have feelings of anger. We have feelings of guilt. All those happen.
Yes.
You're looking forward to something beautiful, but then along the way you don't understand why you're having these feelings of frustrations. Now, to dive again deeper, the feelings of sadness come with I want to bring out depression. Yeah. Depression, I want to attach it to a sense of loss. Loss of a job, loss of a loved one. Now, we are looking at infertility. This person is looking forward to children. Now, what happens if you're given the news of, oh, we are sorry, you're not going to be able to have children? Do you see how you're going to experience that? You're going to lose that experience of being a parent. Yeah. People are going to be talking about parenthood, but for you,
you have no idea.
Exactly. So you feel like that experience of parenthood, you lost it.
Yeah.
Depression.
Comes in.
Yeah, the symptoms. Then for the process of anger, when you try a couple of tests, you go through the processes and procedures, and they are not telling you it's going to be 100%, but you're trying.
Yes.
Now you tried a certain method, and then when you go back to the hospital, they tell you, oh, we are sorry.
Did not come out positive.
Yeah.
You see what happens? You get angry.
Yeah.
At the back of your mind, you may have somehow thought it is not going to work, but I'm trying anyway.
Yeah.
Yes.
But now news has been revealed to you.
That actually it did not work.
Your emotions are heightened. Now, guilt comes in when, let me think of 2 scenarios. This person did not try what to do to have a child.
Yes.
Then this person has tried, but then at the back of your mind, you're like, I think I needed to do something more. You don't know what it is, but your mind is convincing you.
Something you haven't done.
There's something you haven't done.
Yeah.
But here you are. You've done all you're supposed to do,
Yes.
but the child hasn't come. Or I'm thinking of 2 types of infertilities, where you're trying, and then the part where you're told you won't be able to give birth. Now, all those differ depending on one's experience in regards to the journey of looking forward to being a parent.
Yeah.
Then you find still about anger, you find that this person is expressing frustration towards the partner, sometimes towards the society. And society sometimes has a way of
Pressure.
not even pressure, but maintaining that state of,
Yes.
okay, maybe someone brought a question and they did not know that it's going to be sensitive towards you, and they're like, when are you giving birth?
Yes.
What are you doing?
But they always ask those questions. By the way. They don't. They don't let you rest.
Yeah,
Yeah.
true. And you find yourself in that uncomfortable position. You can't explain to this person, I'm trying the best I can.
I've done this, I've done that.
And then even when you want to come up and be like, I was told I'm not going to be able to have children, this person, they may either not listen to you by saying, you haven't tried hard enough. What have you done?
I think most of the times even they don't. I don't think people open up to tell the other people that they have told said I cannot give birth.
Certainly they don't.
Sometimes you just have to keep quiet and
they keep asking questions.
yes.
But then it's eating you up.
It's eating you up.
Yeah?
Yes.
Those emotions are eating you up.
Maybe if I can tell you, like, chip in a story of a lady who was told that she cannot give birth at all, and she moved from one place to another so that she can adopt a 1-day-old. Moved from one district to another and started life afresh, and instead lied to the people at home, I'm pregnant, I'm going to give birth. She has her daughter right now. The daughter is around about 9 years, and people at home know that is her child, but she actually adopted the child. But that's how, like, sometimes because you lied, there is that guilt. Yes, there is that guilt. You do not. That's also an emotion. Yeah.
But then I appreciate that she decided to go and adopt. But then there's this part. There's a way our subconscious will always come out.
True.
It's like I don't have a better word to use, but like a haunted ghost. Yes. So yes, she might keep her secret.
Yeah.
Self.
Yes.
Very
But
safe.
in one way or another, things will come out ugly.
Yeah.
And this is the funny thing I keep on telling people. Society hangs its own people. What do I mean? Our society is very funny. They're the ones criticizing you, but then at the same point, they're the ones that are going to provide you with alternatives.
Yes.
Yeah.
So I'm imagining if that lady was like, you know what? I am not going to be able to give birth to children. I've decided to adopt. And you're free to talk about, you know what, I adopted a child. And this one will be, how can you adopt a child? You did not try. But later, people will come to terms with it.
They stop
And
even
life
asking.
goes on. They stop even asking.
Yes.
Yes. You know, the society, I think there is a time, me personally, I thought of adoption. And then I thought, like, about someone, have you lost hope? Have you given up? Like, they even make you question your own decision. No, I think that's why most people keep quiet. They keep quiet. Let me do this. It's for me. It's for my mental health. It's for my family that I want to to develop. So people always have opinions.
Yes.
Yes.
And I
Because
think
even in this adoption, you can adopt and tell the society, you tell people around you. But then again, there are some who will keep saying, hey, that one is not yours. They keep telling you that one is not yours.
Yeah.
And it still
We are
affects.
surrounded by angry people. Very angry. So,
and I think I think somehow as we continue with this discussion, we will talk about how do you deal with all this kind of behavior around you, with all the negative comments, with all the critiques people throw you at. How do you deal with it? Yeah, we'll talk about them, but for now, I would want to inform our viewers that as you are going through this process of acquiring a child, your mental well-being is key.
yeah.
Yes.
Very, very, very important. Why do I mean? It is going to influence even the whole
The hormones.
in your body.
Yes. Yeah.
Now, let me give an example. What do we mean with the whole hormones? Why is there an interaction between the mind and the body? You see, when you're experiencing negative emotions, there's a hormone that is released from the brain. Now, this hormone, when it is released, I would say it is distributed into some parts of the body. Yeah, the first part, usually it's the stomach. And the more you experience negative emotions, the
more that hormone
is released in high quantity. Yeah, that is why they tell you, when you're experiencing negative emotions, look for something to cheer you up.
Should we call that hormone like an acid? It's like more
Exactly.
of acidic? Yeah.
Yes, it is more of acidic.
Yes.
Yeah.
Because the way you feel when you're angry, when you're sad, it hurts.
Very toxic.
Yeah, it hurts. So it should be acid.
Then you find yourself, you don't have energy.
Yeah, you want to sleep.
Even when you go to bed to rest, you wake
want
up
to
feeling
eat.
like you haven't
You're not
rested
stress
enough.
eaters. I can even order food at midnight.
If we happen to have some other chance, you get to understand why do some people eat, why do other people don't. Yeah. There's an interaction. Yeah. But for now, I would want to encourage people that when you're experiencing mental health challenges, make sure you don't go deep. Yeah.
You don't go deep into your emotions.
I would want to say have that self-awareness in you. Yeah.
You know, when you do that, you're like, I am going far, this is not good for me.
Exactly.
Okay.
So there's that self-awareness that is needed. Even when the doctors are trying to help you to conceive, they're like, relax.
Yes.
Relax. They are trying to communicate to you like, hey, your body won't be able to function if you're really tensed.
Yeah.
Maybe, Josephine, that would bring us like then another question of when should someone, when you're a woman, when you're an individual, not only women, of course, even men are faced with infertility. So you have different emotions. So at what stage should someone seek professional help? Because on a day to day, you feel these emotions. You're angry, you're sad, sometimes you feel depressed, sometimes you feel alone. So when should someone seek professional help?
The moment these symptoms or the emotions you're feeling, the negative emotions, start to interfere with your daily functioning.
Okay.
We are looking at, let's look at a scenario. You could be experiencing these negative emotions for a couple of days.
Mm.
Yeah, but then you're able to continue with what you're supposed to
Yes.
do, go to work, take care of your home, take care of your children. That's normal. Yeah, but as long as they start to interfere with your daily functioning, please seek for professional help. Now, when it comes to diagnosing mental illnesses, they also have a certain period of time they're supposed to happen. Just like when you go to the hospital and they tell you, I'm feeling headache, joint pain, stomach ache, then the doctor asks you, how long? So even in mental health, these symptoms are supposed to happen consistently for a certain period of time. So for depressive symptoms, just to give a hint, they're supposed to happen consistently for 2 weeks.
Okay.
Anxiety consistently for 2 weeks.
Like
Psych-
you're anxious for like 2 weeks.
Yes.
Every day you're anxious.
Every day, and it is interfering with your daily functioning. Yeah. Then for psychological well-being or stress, someone experiencing distress, 30 days.
Okay.
Now, people also need to understand when it comes to diagnosing mental health, most people think there's a machine where they take you
Yeah.
and it checks this one has mental illness. Or maybe they take out blood.
And they
Yes.
say,
So for mental health or psychologists and psychiatrists, we have standardized questions that we ask. And they are standardized tests. But these tests are in form of questions. So those are our laboratory tests. That's what people need to understand. Because I remember there was a client that was referred to me. So I told them, we are going to have a session for 1 hour. We are going to do this ABCD. So after that 1 hour, she said, Doctor, Ngai, you've not taken blood or you've not checked. So I had to explain to her that for mental health it is different. We do it in this kind of way. But for physical illnesses, it is different.
Yeah.
So that's what also people need to understand.
actually, me thought some point like when you're really feeling, you know these people who run like you're on the streets. Sometimes I felt like maybe it was me thinking that maybe somebody should do like a CT scan. This person
And
might
see
have
on
like
their brain.
like a tumor or some twisted thing that may cause that mental ill. That was my thinking at first.
You're watching many movies. Very
Oh,
many.
wait, the people that undress themselves?
Yeah.
Now, those are extreme cases that do not have care. But trust me, that person you see on the street, walking naked, talking to themselves, when they are taken to Butabika and they go through appropriate care and support,
Yes.
they can go back and actually work.
Yes.
Yes.
Yeah.
So the other perspective Ugandans have about mental health or mentally ill patients are the people that walk on streets naked with ragged clothes. My friend, mental illness, I can be here and I'm suffering from a particular mental illness that you don't know. There was a story I saw on YouTube. This gentleman shared his story about the wife who attempted suicide. Unfortunately, it was complete. And the woman was a CEO. A CEO of a famous company, like a rep. This company was known.
Yeah.
But then no one would notice. The advantage she had that each time she got her breakdown, she would not work. So no one would ask her, say, why aren't you coming to work?
Yes.
She would stay at home, deal with her issues. Then
back.
she comes back when she's okay.
Yeah.
Naye, she had a very, very, I don't want to say dangerous, but she had a mental illness. Or that she had to take medication for the rest of her life. There are those kinds. Yeah. Then there are those
Was
where
it
you take.
a condition or it was like situations around her?
It was a condition.
Okay.
Yes, it was a condition. So the situations around her, do you know where someone says, people are following me, someone is after me?
Yes.
Now that's the mental illness she had. So most people will be like, that's a joke, but it is serious. A journey that would take them 10 minutes to the place of work, it would take them 40 minutes. Each time a border passed by, we'd be like, stop, that border is tailing us. You see how it is interfering with her daily functioning? Then if a car passed by, you know, we have mad drivers in Uganda. Someone is really on pressure and you'll be surprised when they are going. Then they overtake you at a high speed. You're like, hey, wait, that car was tailing us. First even park. So you see that she struggled with that illness. When they use route A going to work, they have to use route B coming back home. Yeah. So that's how she was affected.
I've actually, you know, when you interact with most people, every time you talk about mental health and you talk to an individual, a random individual, and you talk to them, you feel like almost everyone has a mental everyone is either depressed, that's what, depressed or sad, angry. And remember the newspaper that said by 2040,
Most Ugandans
were grandma. So it's a serious issue.
True.
I remember we were three girls and we were discussing. I was like, but sometimes do you feel like this? And they was like, yeah, I also feel like that. Then the other one kept looking like, am I interacting with people actually running mad anytime from now? But yeah, it's an honest truth. Like people are going through things. Even infertility aside, even people have children and all that.
Yes.
Married people also are going through their own.
Even us, the singles.
Even the as for the singles,
Are you serious?
do you know? I said even the singles. You never know. So in the singles, you wake up every day, you're in the house alone, you don't have someone to zip you. Hey, sometimes I know sometimes you walk to work when your zip is set, unzip, you reach out to work, please help me zip.
So the first sign is when you notice that the emotions and feelings you're experiencing are starting to interfere with your daily functioning. Actually, that is the number one symptom. Now, sometimes a person can experience these emotions and feelings for a period of time. But then they are able to continue with doing their routine. But then that shouldn't stop you from seeking professional help. If you feel like, near the past week, something has not been right. I've been feeling ABCD. When you feel like that, concerned, please seek professional help. It doesn't stop you from going to a hospital. Other people fear Butabika. It doesn't stop you from going to a hospital and be like, hey, I'm feeling a certain type of way. Just like people feel comfortable going for a dental check, or if I have malaria, it doesn't hurt for you to go for a mental health check.
Do you have to go to Butabika for a mental check?
No. Nowadays there are hospitals that have these specialists, the clinical psychologists. They are on call. Some hospitals have them there permanently. Then there are those hospitals that have that department there, like Mengo Hospital. They have a mental health department. So it really doesn't hurt for you to go and be like, let me go do a mental health check, man.
Then also, how do you help, if you want to help, how do you help someone who is not going, like they tell you there are problems, but they don't show that they are hurting. But they tell you there are problems, and then you see as if they are normal, they are smiling, they are
okay
laughing.
on the
They are
surface,
okay.
but inside.
They will not show it. How do you help them?
The first thing, you as a person that is going to offer support, you need to understand that people are unique. We are different. We are wired differently. What ticks you off will not tick her off.
Yes.
What ticks me off will not tick her off.
Yeah.
Yeah. So this person, the fact that they are expressing their concerns, just be there to listen, even when they are not wailing or like, yeah. Just be there to listen. Or if you have any source of information that would help them, offer it.
Yes.
But let us not forget that human beings are wired differently. We are unique in the way we express our feelings and emotions. For example, men. Men, the way they talk about their issues. Bah, hi, guy, find me here. 2 beers. Man, my wife is A, B, C, D. You be fine. One for the road.
And it's done.
And it's done.
Yeah.
And then the guy comes back and everything is okay.
Yes.
Yeah. But then we've also had situations where you're in the room with this man and he's telling you, chiganye musawo. But then they are not crying, but you see,
Has failed.
yes, they are hurting. They can't shed a tear, but they are hurting.
Yeah.
Yeah. So you need to understand this person, that they are hurting, but offer the support you can. Sometimes this person just wants to talk to someone.
True.
Give
Someone
an
to
active,
listen.
give a listening ear. Simple as that.
Okay.
Yeah. I don't know if I've answered your question.
Yes.
Yes.
So what are some of the coping strategies for people who are feeling, especially individuals that are going through infertility? What are some of the coping strategies to these emotions? Yes.
The first coping strategy, it is very funny. Communication.
Yeah. Communication is key. It is.
Communication. Communication happens in form of different forms. Express how you feel. Literally, partners need to have their safe space. I have a friend who is also trying to look for children. So there's a day she called her husband and told her, there's this test I read about, and I wanted to go to the hospital and see, they check. So the way the husband responded was, I don't want to say that the guy was rude, but he thought he was helping, men, and the way they talk.
Yes.
So I was like, man, don't put yourself on pressure. When you're going to have kids, you'll have kids. If the child is to come, it will come. Besides, I liked you first. I don't care about
I
children.
think in that area I fail to understand men. Tell me, like, a man will want you sit there, God is going to do it. Without working, you get it. A child will come
Without putting in
But that's how they
Yeah.
communicate. For them, that's how their mind was wired.
Yeah.
Yeah, that's why I'm saying I fail to understand men. I'm still
You still-
studying.
You want to graduate.
Not at all.
So
Failed paper.
Yeah.
the way the husband responded, she felt offended.
Yeah.
Like, what? Meanwhile, a few weeks ago, the sister to the husband was there. Well, when are you having kids? What's up? What are you waiting for? She kept quiet. So, in that period, she decided to hold back the feelings.
Yeah.
Yeah.
She acted normal, came back, everything was okay. But then the fact that the husband knows her, she was like, Gundi, what's not going on? I'm sensing you're acting funny for 2 weeks. Then she was like, I guess this is the moment where I need to talk about this. So she talked to the husband. Last time I talked to you about this ABCD. You said this. I didn't feel good. Each time I talk about the topic for having children, I'm not coming from a desperate point of view. I just want us to have a conversation. Your job is to listen, either encourage me or have that empathetic conversation with me. Other people will not really understand what's going on within our space here, but you understand. So I expect support from you. Husband apologized, and life moved on. So couples need to have that safe space.
Yes.
Where they talk about these emotions. Now, men are not good at communicating these emotions. Women need to understand that. But as long as you're your husband is able to give you the platform to share how you feel, and they tell you what they feel, at the back of your mind try to understand, like, this gentleman is actually, he cares about how I feel.
Yes.
But that's how he communicates.
Yes.
There are those men that are good at communicating.
But in this case,
There are those that are not.
If it's the man who is going through this,
Mm.
is going through, of course, you've done the tests, you've done everything, a woman is fine, but the man has maybe a raw sperm account and all that, it's his problem, and he's going through that situation, that phase. How do you communicate? How do you have him open up and communicate with you? Because we know men are bad communicators. They are terrible. So how do you open up? How do you make this person open up to you, talk to you, and you support him?
I would want to say, I would want to believe that men do open up. Either we women don't know how to listen to them.
Really?
Yes.
Okay.
Like I said, their ways of communicating is different from how women communicate. So you as a wife, you're mandated to understand, how does my husband communicate when they're expressing their emotions?
Yeah, that's okay.
Yes.
I told you I want to understand men.
So I do not have a specific answer to that, but what I would want to encourage is that wives know how their men communicate. If you have been keen enough. An example, the way my husband communicates, he talks about it like it's
a joke.
It's a joke. It's like, and he's done, and he walks away. So it's up to you to be like, wait a minute, this guy asked me something. And when you come back to ask again, you tell you have forgotten.
But there are also some men who don't really communicate. They don't talk.
True, because just like you as an individual, you would be feeling like, how do I start this conversation? How do I tell my wife? Let us add in the aspect of ego.
Of course.
There's a way society has given us an identity.
Yeah.
When you're not a parent, when you're not able to give birth, you're not a woman, or you're not man enough.
You're not man
So
enough.
you acknowledging those feelings of, I'm not able to give birth, or I'm struggling.
Actually, I think the fact that they have now labeled it's the woman who cannot give birth, it is the society is more hard on men.
It's hard on everyone.
Yes, it's hard on everyone, but in a relationship, when you see someone, they are not conceiving, the first thought is like,
the woman.
The woman has a problem. She's
It's never the
or
man.
she's not, there's a lot people say out there. They will say it's always about the woman. She's not giving birth. She has a problem.
Yes.
She aborted
Many times.
many times. I saw something that disturbed me by a certain doctor on Twitter, where she was saying the cause of infertility in women is it's because they adopt family planning when they are still young, and they start also abortions when they are young. I asked him, really, is that the reason and the root cause of infertility right now? That's the most thing that has caused infertility at this time. And he insisted, yes, but I don't think there are people who are battling with infertility and have never gone on family planning.
Yeah.
Because first of all, if you notice that you have hormonal imbalance, you don't even have a reason to go on family planning.
Yes.
You don't even have to plan for the family that you don't have. So I still don't think. I think
it just contributes.
Yeah.
Statistics,
Yes,
really.
it contributes, because you see people, even old couples, when they go on family planning, they'll tell you when you remove your implant or something or IUD,
It will
take some time before you conceive. When your hormones are doing what? When they are
in order.
Yes, they're getting back in order.
And also on the abortion part, I think it depends on who has done it, how they have done it. Some affect the uterus, or in a way they are reproductive system gets affected and they are not able to give birth.
Yeah, there is what I expected of him as a doctor.
To explain.
Yes, I
Okay.
expected of him to focus on the major causes, because
Oh,
there are
okay.
the things
Okay.
that cause infertility
Okay.
than abortions. Yeah, I'm not saying abortion is okay, but I'm saying it's not the major cause of infertility. Yeah.
So for men that are not able to communicate, I would still encourage the partner to show expression towards this person that, hey, you're going through something, but I'm here. I have your back. When you're going to talk about it, you're not going to be this person of like, now why didn't you tell me? Immediately that person will hold back. So, and the way men talk, it's like you're having a conversation. Otherwise, if you be like, yeah, like...
By the way, there are some men, when you're talking, you're telling them, they keep quiet. You talk when you're... Are you listening to me?
I'm listening.
And then you wait for his response and his...
I think it's okay. That's the fine. Moving on. We have a few minutes remaining. I want to, how do we break the stigma that surrounds infertility?
I wanted to offer more coping strategies.
Yes.
Apart from communication,
Oh, yes.
there's acceptance. Yeah. Acceptance happens in very many ways. If you're not going to be able to produce, you have to make sure that you deal with that emotion of, I'm not in position to give birth. There's nothing I'm going to change.
Yes.
That is how I was created. Yeah. So, accepting the condition that it has happened, and there's nothing you can change about. There's nothing you can do about it. It is very, very, very key, rather than living in denial. Yeah.
Yes.
Then the second part is the second coping strategy is mindfulness. It is actually key for both. Mindfulness is more like living in the moment. Most people say, enjoy today. Yeah?
Only live once.
Yeah, you only... That's okay. People are entitled to opinions, but living in the moment, what do we mean by living in the moment? You have something you're focusing on, but do not forget other aspects of your life.
Yes.
Do not forget you're supposed to take care of your husband. You're supposed to take care of your home. You have a job. You have friends. Eh? Don't forget other aspects, and so that to make you feel like, oh, Bananga, I need to get children, and like if I don't, I am dead. You need to be mindfulness. You need to be mindful. There's I forgot that paper. I wanted to have it with me. It says, are you mindful or mindful? Mindful is like we are here, we are talking, but then your mind is far away. You're thinking about garbage, irrelevant things.
Yeah.
Your mind is full.
Of
But-
many things.
But being mindful, you're in the present moment. You're doing, you're reading a particular book. You're reading a particular book. You're focusing on that book. You have come home. You've left work. It's home time. Enjoy the family moment. That is why you find someone says, Panange, how did I miss that moment? You were in the moment. You just decided not to stay in the moment. Yes, you are mindful, not mindful. So people have to live in the moment. Yeah. Even when you're going through these processes, because sometimes you find that the medication or the treatments these women get, they also contribute to stimulate mental health issues such
Yeah.
as anxiety.
Yes, yeah.
Some drugs have side effects, like someone is experiencing psychological distress. So all that, when you've gone to the hospital, they've given you medication, understand the type of medicine you're taking. Because you might be there thinking, oh God, I don't know why I'm stressed, I'm trying to keep things together, but kumbe it is the medication that is contributing to that. So please stay in the moment. Then in regards to coping strategy, the last point, you know, hobbies.
Yes.
Yeah.
What's your hobby? Sorry to ask.
Swimming.
What's your hobby?
Singing.
Watching movies. When did you last swim?
She's already a psychologist.
2 weeks back.
So we usually encourage people to continue participating in
Their
things
hobbies.
that
Like,
bring pleasure to them.
But what I've noticed, when you're stressed, there is the way you just even don't
You really
want
don't want anything.
anything, not even your hobbies.
It is true, and it happens, and it is okay. But we are looking at a situation where you're starting to go overboard. Yeah? You're crossing the normal line. There you need to make sure you engage in something that gives you happiness. Because apart from the medication that is given to you, you're not going to be on medication forever.
true.
Yeah, that medication just tries to balance the hormones because, it is hard to drive you, to pull you away from those depressive symptoms where you have dived in deep. Yeah. But if you haven't reached that extent, the things you engage in to bring you happiness contribute, because when you're happy, another hormone is released.
Yeah.
You've had situation whereby panange sanyuka koja kumerenkanyanya. Or someone who is extremely sad all the time, you feel like they are too old for life. This person is happy, jolly. You're like, panange, they are glowing. So you see that connection. So people shouldn't really undermine hobbies. They play a very, very big role in stabilizing our mental well-being. Yes.
Okay. So that brings us to our last question. How do we break the stigma that comes with infertility? Society, like the way society views it, the stigmatization, how do we break it?
Breaking the stigma happens in very many forms. Right now, we are breaking stigmatization.
Yeah, we are.
Advocating the media platforms that are talking about these topics, bringing people's stories. An example I'll give, I remember after our wedding, the pressure I experienced to get children. So I went on a rampage of watching YouTube videos of how did this person deal with this, how did they. Later I figured out there's nothing you can do. They'll give you the pressure, but are you going to swallow those sperms so that you get pregnant? No. But then when I watched other people's stories, I found out people waited for 10 years.
Yes, I saw.
People waited for
60 years.
What? 60?
Yeah.
Yes. Insane things people do to get children. And you're like, I am desperate, but I won't reach that extent.
There is someone, I don't remember that lady, but she was on social media, and they told her she's supposed to drink the water that is running in the trench.
Lukoka.
I'm sorry, I'm laughing.
When it's raining, you know the trench, and it
Yes.
has to be over in a slum or what? She would go
Kampala,
there.
and I watched that
Yes.
story. You're not
Someone,
alone.
so she had to go with someone to help her pull and drink water.
To pull her or
To hold
Ah,
her.
so that she doesn't
dear.
fall.
But-
because you can fall there.
But now you imagine
What
that
kind of-
person who told her to go do that. What if that
But
woman
did
had
she
failed in?
conceive?
Yes, she did. But
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 that's
not because of
but that's
Lukoka.
not
Not because
water
of
that
the
we
running
have.
water.
Are you sure it's not?
That's the word.
actually, that
you want to encourage people to
that act, I think it gave her insight of, okay, wait,
Yeah.
I've gone far.
Yeah. It's too far.
Yes.
Yeah.
She's like, I've gone far. Then she was like, wait a minute. Now what if I had fallen into that trench?
No, you know, when you're desperate, I think you can do anything.
And after doing it, that's when you see
you'll be like, one night.
Just do this.
Chokanga, these are the friends that be like, I know that person. So the platforms, through in form of advocacy, right now, we are giving information to someone, and we are creating self-awareness. So for people to deal with stigma, it is not going to go away. That is number one. But then you have control of your space. You don't have control of the things outside your space. However, it takes me back to the coping strategy of acceptance. As long as you know what you're doing, at the end of the day, even when you labor to explain to someone, Banange, I am doing what I can, they will not understand because things were easy for them.
Yes.
They don't know that people have to really struggle to get children. They have no idea. Unless when you've been in that position or in that situation and you know how it feels, you've been there, you'll be even sensitive when you're asking, be like, hey, Prosi, what's up? Like, man, like, it's okay. It's okay. One step at a time. Yeah? So, stigma, you do not have control over how someone is going to treat you, but you have control how you're going to feel. You imagine a situation, you're in that process, treatment procedure, and this person comes and asks a silly question or an insensitive question. An insensitive question, and you're like, Carl, I wish this person knew that I'm working out something. Already, they have started to compromise on your mental well-being. In the hospital, the doctor told you, relax. You need to relax. Yeah? So, people need to tap into their strength or resilience. That resilience is your ability to go through a challenge. We have strength, we have weaknesses. So focus on the strength you have. Focus on the things that are going to give you strength or courage to continue with life. Otherwise, society is still there to point fingers at you. Then at the same time, they'll be like, oh, you know. So self-awareness is also key. Self-awareness is also key. Then when you feel like you really can't deal with the pressure, still seek help. Seek help. Because I'm not, when you come to talk to me, I'll not tell you, let us go talk to that person, or let us go talk to the world that you're really trying your best. For me, I'll deal with you.
But actually, the society, the world should understand that people are doing, they're doing their best. They're doing their best. These women are doing their best. These men are doing their best. So they should understand that.
I don't want to shake the tables and pour the drinks, proceed. But society will never understand. They'll never. They'll never. That is why it is really key for these fertility centers to have psychologists there.
True.
Not even before the person starts, the couple starts treatment, a psychologist has to be there.
Which is a problem. These fertility centers, they do not have psychologists. They don't.
Some of them.
Yes.
Some of them don't.
A few have. A few. But most of them do not have. And it's a big gap.
Indeed, it is. But those that are able to find one, if you can inform the hospital, we have a psychologist, want to bring them on board. They play a very vital role prior to the treatment, during and after. Because there's also a possibility where you've gotten pregnant after that vigorous process, but then you worry, will the child be in there? Now what you do? Then you experience the emotions. Your emotions are heightened. Then your mental well-being is also
releasing the acid.
So all that, the psychologist is needed at all levels until
you've carried your baby.
And everything is.
Thank you so much.
You're welcome,
Josephine. Thank you so much, our viewers. And I hope we have learned something. We have learned how to deal with our emotions. because no one has control over our how we feel and our emotions. So we should always take charge of our emotions when we are going through infertility, when we are going through the treatment and everything around us. So do we have a last word to our viewers?
Thank you, Josephine, for this very, very mindful topic that we have had today. Dear viewers, thank you for staying with us until the end. Do not forget to like, share, and comment. And in case you have any kind of topic or anything you want to hear from us, please comment. We shall read and we shall be able to get back to you.
Thank you so much, our viewers. Thank you for commenting, for liking, for sharing. Thank you, Josephine, for also coming and sharing with us this interesting topic. We've learned. I think our viewers have also learned a lot. Yeah.
Okay, thank you so much. Let's be in charge of our emotions. Until next time.
Bye.
Bye.